So this is a mobility drill to attain some thoracic flexion. And so what I find when people are chronically over breathing, meaning they don't get a full exhale, is they actually kind of get stuck in extension. And I know that this can seem counterintuitive because a lot of times we're really worried about this kind of slumped shoulders, forward head posture. But there's also a lot of people who are just always trying to pull their shoulders back. When we go to test their thoracic extension, rotation, their ability of the rib cage to move, they still appear stiff. That's just because they're already pre-positioned in that extension. But we see that their rib cages are flaring. They kind of look a little barrel-chested maybe. They have some lumbar extension because their body's trying to attain this upright posture, but they're overextended. And so by getting a full exhale and some flexion, we can start to regain full mobility of the thoracic spine and the rib cage. So here's what we're going to do. We're just going to lean against the wall, and I want to lean against the wall such that my low back is flat. So I want to just feel the wall against my low back. I'm not doing a wall sit or anything. I'm just kind of leaning casually against the wall, and then I'm going to cross my arms. My head is going to touch the wall, and what I'm going to try to do is just come down segment by segment until I get to my lower back. And then I'm going to come up. So segment by segment. Doesn't look like a whole lot, but some people, what we'll see is that they can't differentiate these segments and they just kind of come off the wall all at once. And so we don't want to do that, but we want to roll down the wall. To add a little weight to this, which sometimes can increase the effectiveness, I'm just going to take this weight and cross it over my chest, and I'm going to come down. And then I'm going to add some breathing. So I'm going to exhale as I come down. Full exhale. Inhale up. Exhale down. Inhale up. Exhale down. And here I'm starting to get a little work now because as I inhale, still keep my low back flat, but I'm trying to drive into some extension. And then I'm going to exhale and brace the core. Bring the ribs down, come into flexion, feel a little stretch there. So that's our thoracic and rib mobilization drill to establish some better mobility in this sagittal plane.